Towards the end of life, people can have distressing symptoms that are difficult to control. Symptoms like severe pain, breathlessness, nausea, and agitation. Sedation is one option to make people more comfortable when all other treatments are ruled out. But the definition and use of sedation varies across different countries. How, as health professionals, do you make the right decision for patients in your care? Palliative sedation seeks to relieve suffering by reducing consciousness for a period of time. It differs from euthanasia. Palliative sedation aims to relieve suffering, not to end life. We are researchers from the Palliative Sedation Project, where we studied its use across Europe. We followed 80 people in 5 countries who had had sedation at the end of life. We found that sedation resulted in good control of symptoms in the majority of cases. Sedation can provide relief from difficult symptoms by lowering the patient's consciousness so they are less aware. This allows respite from suffering for the patient and those around them. Palliative sedation is always used proportionate to the patient's needs. Light sedation is used occasionally or intermittently. It might be used to address occasional difficult symptoms or used at night for patients who have trouble sleeping. Continuous, deep sedation is used in some settings and enables patients to remain unconscious until the end of life. Whatever the approach, choosing the right sedation requires careful clinical consideration, care, and discussion with patients and families. Our study recommendations were brought together in the Brussels Statement in April 2024. The new framework on palliative sedation recommends that duration and depth of sedation should be in proportion to the patient's situation. Light sedation should be attempted first, except in emergencies. Deeper sedation should be considered when light sedation has been ineffective. The guidelines highlight the importance of shared decision-making with the patient and family. This includes discussing sedation as early as possible with the patient and family. This identifies patients' preferences before they lose the capacity to share them. Talk to patients, families, and your clinical teams about sedation. Sedation is an end-of-life care option that can bring comfort and peace. For more about the research, visit palliativeprojects.eu/palliative sedation.